Hello, I'm Dr Magill. I'm a neurosurgeon at Northwestern Memorial Hospital and an assistant professor at Northwestern University. I take care of patients with brain tumors, and in brain tumors there's kind of what we think of as like the worst brain cancers, like glioblastoma. Glioblastoma is an aggressive brain tumor. I take care of patients with that. But I was also very drawn to more of the skull-based tumors and tumors that often have a little bit more of a benign course. And unlike aggressive brain cancer, where there's a lot of funding for research to try to really develop new therapies for that because of how devastating they are to people, areas like meningioma are often understudied. Because of that, we only have treatments with surgery or radiation. And so a lot of my research has really focused on understanding the biology of meningiomas better and then translating those insights into both new therapies from a drug standpoint, which there's no current medical approved therapies, or also developing biomarkers that would understand how people's tumors are going to behave, when the tumor is going to come back, or when it is going to respond to radiation or not. My grandfather also actually had Parkinson's disease, and so when I was interested in this and just a young person in undergrad, in high school, and was seeing that start to affect him a lot, where he was shaking, he couldn't travel anymore, he couldn't function a lot of the ways he wanted to, I got interested in deep brain stimulation. And that naturally drew me towards medicine and towards neurosurgery. So there was that personal bent, both in understanding what causes neurosurgical diseases like Parkinson's disease, and then his experience that kind of triggered in me this interest in the brain and pursuing neurosurgery from a personal side. From a diagnostic standpoint for tumors, in the past we would look at the tumor under the microscope and just say, oh, you have a glioma or you have a meningioma. Whereas now we can look at the molecular characteristics of that tumor, and we are starting to do that on all kinds of tumors. Where we used to just say, oh, you have this tumor, we'll treat with this same medication that kills all dividing cells, like a standard chemotherapy. Now we're taking a more nuanced approach, and we take out a tumor, we find the mutations in it and say, hey, let's try a targeted therapy. Maybe it will help, and maybe it'll be less toxic, maybe it'll be more effective. So it's an area you're trying to discover what would help for these diseases, and much of it comes from creative thinking. You do what you know works, but in some brain tumors like glioma, where you don't have a great option, oftentimes thinking outside the box can identify potential new solutions for patients.
Dr. Magill and I have been working together for about a year. He comes very well trained and very well prepared. The biggest thing that I have to say with Dr. Magill is he is very patient with his patients. He likes to just listen to them with his whole body, mind, and spirit, and just give the best care that he can to them.
One of the more memorable things that happens in taking care of neurosurgical patients is really seeing the impact on their life. And when I think about that and the joy that that brings to me, and to be able to be a part of their journey, and particularly at such a critical point in their journey, I think there's always traumas come to mind because they're impressive and difficult. And I think about a young man who was in a car accident. He had a very bad head injury. Many people thought he wouldn't survive or do well. We were very aggressive in his surgical treatment. We decompressed his brain, took half the skull off, which allows the brain to swell, and then he was in the ICU for about 3 weeks. The gentleman took some time to recover, but I followed him, and eventually he came back. We did another surgery, put his bone flap back in once the swelling had gone down several months later, and he was able to talk. He said, thank you for saving my life. He was able to walk and stand up, and he had been literally on death's door back and forth for about a week or two in the ICU, where we didn't know, and it was just a very rocky course for him due to the nature of his injury. It makes me know every day is worth it, and that what I'm doing is important. And, even when I'm alone under the microscope there working away hard, like it's actually, we're making patients better and taking them through these really treacherous times where, it's up to you to get them through it, to make those decisions. Do I take this little bit of tumor or do I leave it? And that decision making, I think, and to see patients doing well, is you don't forget that. And thankfully, it's something I've gotten a chance to see a lot while I'm here, because I deal with a lot of complex tumors, and patients have been doing really well, and that makes me happy with my job and what's going on. It's really impactful.
So I was really excited when Dr. Magill joined the faculty here last year because he shares a lot of these same research interests. So right now we work really closely together on a daily basis, oftentimes in a clinical setting, but also in research, really trying to answer some of these important questions with meningiomas. Having him kind of as a mentor in the surgical setting as well has been really amazing. And I think there have been many memorable cases, I think, just kind of learning how he approaches brain tumors and as a surgeon, that I think have had a really positive impact, on my experience as a resident.
Neurosurgery is amazing because it's brought a lot of meaning in my life. It's made great connections with patients, and it also gives you a better understanding of reality because you see so many people in so many different walks of life and situations come with a major problem, and you can help them, but you also get exposed to this, and it actually reflects on the decisions that I make in my day-to-day life because you see a perspective that most people don't get to. Once a week I sit down and meet 20 other people that are going through crazy things, and you hear about their life and you think about how that impacts their life, and it really makes you appreciate what you have. It's such an amazing life because when you have that perspective on a day-to-day basis of what could be going on, it really actually in turn makes you so appreciate the moments that you have.